Now to the health sector. For more than a decade, hospitals in Borno State were not just centers for healing. Many became shelters, battlegrounds, or were simply abandoned. But now a fresh chapter may be opening. A delegation from the federal government visited Maiduguri, not with speeches, but with bricks, beds, ambulances, and bold promises. Senior reporter Jesse Tafida tells us more.
For years, these corridors at the University of Maiduguri Teaching Hospital echoed with pain. Limited doctors, few equipment, and a flood of patients escaping violence from all corners of the state. A generation of doctors, nurses, and patients struggle to survive, not just sickness, but insurgency. But today, the mood is different. From somber whispers to hopeful chatter, there's change in the air. In a major show of federal support, the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, is in Maiduguri, and he's not alone. Alongside top officials and medical experts, the visit is part of a renewed national health strategy, with Borno as one of its most urgent priorities.
Health is one sector that the President is trying to use to unify this country, to heal this country, but also to inspire. Just by the work that we're able to do as Nigerians in improving our health sector, I believe our own confidence is just continuing to improve. As a minister, I'm so humbled to see the amazing work that is happening in all federal facilities wherever I visit. On the affordability side, NHI is expanding the health insurance, making it more affordable, whether it's cancer care, nephrology care, or even emergency obstetric services, which federal government has already reimbursed more than 4,000 cesarean sections in the last few months for women who needed it.
The head of the civil service of the Federation, D.D. Wilson Jack, also stressed the importance of efficient health governance, noting that capacity building for workers is just as important as infrastructure.
This gesture underscores the importance of workforce training and especially of management of healthcare institutions.
From theory to action, the highlight of the day unfolded at the University of Maiduguri Teaching Hospital, Nigeria's largest tertiary facility with over 1,500 beds. 4 state-of-the-art projects were unveiled. The Bola Ahmed Tinubu ICT Center to digitize records, improve research, and enhance telemedicine. The Northeast first ever heart center, a long overdue facility to tackle rising cardiac diseases. An interventional radiology center equipped for early diagnosis and non-invasive procedures. And a 150-bed stroke center, the first of its kind in the region, addressing the increasing toll of brain and nervous system related conditions.
Therefore, urge you to engage in meaningful dialogues, leverage collective expertise and foster partnerships and collaborations to chart the way forward in revamping our health sector for efficient, affordable, and qualitative healthcare delivery.
Governor Babagana Zulum's administration has often highlighted the need for decentralizing healthcare. While these flagship projects based in Maiduguri, much of the state, especially rural communities, still suffer from limited access, poor transportation, and insecurity. The statistics are sobering. According to the Ministry of Health, over 48% of Borno's health facilities were either destroyed or rendered non-functional between 2009 and 2021 due to the insurgency. But there is cautious optimism, especially from patients and frontline health workers. As the delegation departs, the people of Borno are left with both new buildings and renewed expectations. So, is this the beginning of healing? Not just for the body, but for a state long wounded by war? Time will tell. But for now, these bricks, machines and commitment represent more than just infrastructure. They represent dignity, hope and a second chance to life. Jesse Tafida, TVC News, Maiduguri.